So this is again just an ankle taping job, but a little bit different in terms of the materials used to do it. Same basic principles apply as any other normal ankle taping job. It can get a little bit more interesting just with the rigidity of the tape in terms of your angles, so that is something that you're going to want to pay attention to. But the same things apply with looking at inversion versus eversion sprains that will play into your taping procedure through your clinical reasoning in terms of what way you want to pull your stirrups, how you want to apply your heel locks, and any other type of taping mechanism to help hold that ankle in place. For this one, we're going to want the ankle in dorsiflexion. We forgot to mention that in our ankle tape job. But then we're going to use tape wrap underneath, not pre-wrap. This will allow for a little bit better adherence to the skin, which will be less slippage, especially when you start sweating, and also allow for better adherence of the Thor tape to the underlying wrap. So that is why we would utilize that specific type of tape for the underlaying of this one. Same basic principles apply. We could use heel and lace pads again for comfort. We did not in this video, but that is something that you could utilize again if you cover the anterior ankle well, along with just on the back side of the Achilles. That will oftentimes be enough to prevent any friction or rubbing from occurring. So again, we're going to start with our anchor strips up top, 2 or 3 depending on the size of the ankle. For this, we are working medial to lateral as if we were going to tape for a lateral ankle sprain with our stirrups. We like to fan these out at the top with just a little bit of overlap on the bottom in terms of how wide that goes. You do not want to get too far forward and compromise the base of the fifth. We will then add the rest of our closure strips going around. This is to ensure our stirrups stay in place and also allow us to have some areas to help hold down our heel locks as we go through. So again, we want to make sure we're covering up any open spaces. This can be a little bit more difficult if you don't have different colored under wrap to see, but you want to make sure that there's no open gaps, especially if this is an injured ankle that could allow for some swelling to settle there. Starting lateral to medial, working our heel locks, able to get a continuous one here. With the tape being more rigid, it can be a little bit more interesting with the heel lock, so you have to take a good strategy going ahead and just be careful with your angles as you're laying it down in order to get a good result. With this one, we just did a half of a heel lock, so we just went once around, and then we finish it up going the opposite direction to help keep that in place. We do go up through the middle of the foot lightly just to help close it all in. That is typically up to patient comfort. And again, you want to be careful of the base of the fifth there to not put too much pressure on it.